Welcome back. Today we will learn about schizophrenia. So I know psychiatry is that subject people won't prefer to make notes. Still, if you want to write, you can make a notes, or if you want to revise a topic directly, you can see my video during your exams. So we will look into the important parts which are required you need to attend during your exams, so that it helps to fetch you marks and some basic knowledge for undergraduates. Okay. Epidemiology. Prevalence. This is lifetime prevalence, which is 0.1%, and male equivalent to female. Then age of onset, adolescence, and young adulthood, preferably 15 to 24 years. So this is epidemiology. So then next point you need to remember in this is Kurt Snyder is a very important person in schizophrenia thing. So why he is important? Because he described 11 symptoms. 11 symptoms which are called as, CA means called as, Snyderian first rank symptoms. Okay. So what are those first rank symptoms? We have 3. Remember 3. First set of 3 symptoms are included under thought phenomenon, which includes 3: insertion, withdrawal, then broadcast. Then we have made phenomenon, which includes 3. What are those? Volition, affect. We will learn these in detail. First we will learn what are the given headings. Then impulse. Then last 3 symptoms: auditory hallucination. Okay. So insertion means someone is inserting some thoughts into him. Withdrawal, someone is taking his ideas from him. Broadcast is someone using him to broadcast their idea. Okay. Then we have volition, someone is controlling their action. Affect means controlling the emotion. Then impulse means controlling the impulse. Basically you need to write only this much, not in detail. Okay. Then we have auditory hallucination, which includes first one, voice giving running commentary. Then audible thoughts, which means thought echo. Then we have hallucination, called as third person hallucination. Here what happens, like third person, you know that like third person words are he or she, like this. One person is talking to other person and you are the third person, so he is talking about you. These two people are discussing about you. Like example, he speaks so much whole day. One person is talking to other person about the third person, where third person is you. Okay, you means not you, the patient. Yeah, right. Then other symptoms like delusional perception. Yeah, these words like basics, delusion, perception, you can go and see in my basics of the psychiatry. We discussed about it in that video. You can find those meaning. Yeah. Then we will see somatic passivity. Okay, these are the 11 rank syndrome symptoms. Yeah. Okay, there is no doubt, I guess. Then we have etiology. Etiology and pathogenesis. Yeah, so mainly we have two etiology, not exact etiology, like they are considered better for explanation. Neurotransmitter hypothesis, the other one is genetic factor. Yeah, this under this, the main reason is dopamine. Increased level of dopamine. There is other pathogenesis says like dopamine and serotonin. Increased these two hormone levels will leads to schizophrenia. Okay. Then we have genetic factor Dye-George syndrome. About this Dye-George syndrome, we discussed very detailedly in our pediatric section. You can go and watch to that, where there is a deletion of 22q11.112 deletion will be there. Okay. These are the etiology and pathogenesis. क्या भाई इतना सब हो रहा है? Yeah man, psychiatry is big. You need to remember, revise. You'll get a one question. To that you need to study whole subject, right? Nothing. It helps you somewhere, right? Then we are going to study about symptoms of the disease. We have two types, like it is called as positive symptoms, then we call negative symptoms. In positive symptoms we have two: delusions, hallucination. In that, most common is auditory. And what about the second one? Yeah, first only you need to remember first, then we will remember second one also, visual. Then we have negative symptoms. Yeah, this is a big list. Just look into this. We already discussed about this in our first video, basics of psychiatry. So you can watch this, in that video for more details. Avolition, loss of drive for goal directed activities. Anhedonia, previously you were pleasured with that activity, now you are not getting that pleasure. Then asociality, no need to explain this word, I guess. Then affective flattening, there is no emotions. If you give some sad news, good news, it will be same. Okay, these are the mainly involved symptoms. Then others, like we have disorganization symptom. It involves behavior. Then we have speech and thinking. Inappropriate affect. What this guy is using? Affect. What affect? See the difference between mood and affect. Both are used interchangeably, but preferably this is a short term thing, but this is a long term. Okay, there is no confusion, I guess. Okay, then we have important symptoms called as motor symptoms. These are also called as catatonic symptoms. So we have stupor, waxy, flexibility, posturing. Let's study the important thing so that you won't get confused. There are many. I will explain which are important in detail. Echolalia, echopraxia, grimacing. We have some other extra like ambi tendency, just for completion. Stereotype P. Mannerisms. Okay, important one are waxy flexibility, posturing. So waxy flexibility means when you hold a candle, you try to bend it. This is a normal candle. When you try to bend it like this, initially there will be some resistance, then it will be smooth, right? Initial resistance, later smooth. So here also what happens, when you try to give a passive movement of a limb of a patient, initially there will be resistance, but later smooth. This is the meaning of waxy flexibility. I guess it is clear. Then we have posturing. See, when you make a weird position, like this is the head of the patient, then this is the upper limb, you keep his hand like this. Okay, when the patient is normal, you feel like this is discomfort, right? But that patient maintains this position comfortably. So this is called posturing. He'll maintain the same position. Okay. Then we learned most of the things. Then we are near to that. So what are the treatment modalities? Treatment. According to DSM, we have ICD and DSM, right? Both are like for the same symptom, they'll give different criteria for treatment. It usually defines that patient is eligible for the treatment. So this the DSM-5 says that at least illness should be at least it should be around 6 months. Whereas ICD-11 says that it should be 1 month at least. So we'll go for a treatment. Treatment is antipsychotics. You can find our antipsychotic videos detail in pharmacology section. We will learn the important drugs here so that you can write things which are necessary in psychiatry. Antipsychotics will be the mainstay of treatment. Okay, we'll classify antipsychotics into two. What are they? Typical, atypical. So why there are two classification, like why there are two class of drugs? So we need something to classify them, right? So we have a differences. This mechanism of action for typical is it acts on D2 by antagonism mechanism. Okay, whereas atypical it acts both on D2 and 5s2A. Okay, this acts on only positive, but this all acts on both positive and negative. Extrapyramidal symptoms, these are high in this use but less in this atypical. Then we have metabolic side effects, where vice versa, less, high. So we will discuss first about this extrapyramidal symptoms. Make a heading, listen carefully. Like extrapyramidal symptoms. Not in a detail. These extrapyramidal symptoms you will learn in that CNS section. If you want, you can go and watch that CNS section. Now we will learn superficially which are required here. First one, movement disorder. The main thing you will see is drug-induced Parkinsonism. Drug-induced Parkinsonism, right? The name itself says what it is, where the symptom is tremors, which will be 3 to 6 hertz, plus it's a triad, right? Rigidity and plus bradykinesia. Okay, so if you want to prevent or treat this, usually we add antipsychotics, which will be given to the patient already. With that you need to add anticholinergics, because this acts on D2 receptors, right? Because of this, symptoms will be seen. So to control that symptom, we will use anticholinergics. So we use mainly two drugs are there. Benztropine is a drug of choice, or you can use trihexyphenidyl. There is a big list of drugs, but you remember these two drugs. I think it will be helpful. Then we have second symptom, acute dystonia, means sudden contraction of muscles. Contraction of muscles, okay, which may like seen like torticollis or trismus or deviation of eyeball. So, or it may be even laryngospasm, laryngospasm. This is a dangerous sign, right? So to treat this, we use IV anticholinergics. Not IV, sorry, it's a IM. Most commonly we use promethazine. Right, I hope it's clear. Then other we have like acute akathisia. We give treatment as propranolol. Then we have tardive dyskinesia. This happens due to long-term usage of drugs. We have many other, like fifth one, important one is malignant syndrome. Due to D2 blockage, this causes due to D2 blockage, okay, where we will see the symptoms like muscle rigidity or heat regulation loss due to hypothalamus overinterruption, muscle injury leads to CPK excreted in renal thing, which may be, this leads to myoglobinuria, which leads to AKI, nothing but renal failure. Hope this is clear. So this is movement disorder side effects. We have another set, endocrine side effects. This is mainly seen in risperidone or amisulpride drug. Okay, so this was the side effect thing. So mainly typical, we use chlorpromazine or haloperidol, etc. We have many drugs, but these are the main drugs we use. And in atypical, we have clonazepine, important. About this clonazepine, we will discuss in pharmacology very detail. This is a very important drug. Section. Okay, so we learned about treatment. So we have what is the good prognostic factors and bad prognostic factors. Good, bad. See, if disease is progressing or it started acute, then it is good. Then insidious in onset, it is bad. Then we have age, advanced age above 35 years, if it happens, it is good. Less than 20 years, if it happens, it is a very bad condition. Females, lucky fellows. Males, always bad. Happens with the bad things. Poor people. Then we have here prominent positive symptoms, then we have negative symptoms. Then we have family history. If it is there, we will be knowing he is going to undergo this, so we will be taking precaution. If we don't have family history, then we won't be know that he is going to develop this schizophrenia, so it will be difficult to treat. Okay, I hope That is clear. So we will revise quickly. Schizophrenia, it's a type of a psychiatric disorder where prevalence is 0.1%. Male is having equivalent prevalence with the female. Age of onset, adolescence and young adulthood, around 15 to 24 years is most common. Kurt Snyder gave 11 symptoms, which is called as Snyder first rank symptoms, where three you need to remember. We have 11, but you need to remember mainly 3 things so that you won't forget 9 symptoms. Okay. Insertion, withdrawal, broadcast. Ovulation may affect impulse. Auditory, we have voice giving, running commentary, audible thoughts. Then hallucination, where I gave an example of third person how it will be. Then we have delusional perception, somatic passivity. Then we have etiology and pathogenesis, 2 types, neurotransmitter hypothesis, then genetic factor. In that mainly dopamine and serotonin plays a role. Dijor syndrome, you can see this in my video. Symptoms, we have positive symptoms, which is hallucination and delusion, where in hallucination auditory will be more than common than visual. In negative symptoms, evolution, anhedonia, lack or loss of pleasurable activity, previously it used to give pleasure. Then asociality, affecting flattening, no emotions. Disorganization symptoms, behavior, like add a disorganization because it will make a lengthen so I made it short. Disorganization behavior, disorganization speech and thinking, inappropriate effect. Effect, I said like it's a short term thing, mood is a long term, both are same. Okay. Motor symptoms, it is also called as catatonic symptoms. We have stupor, waxy flexibility, that candle example you remember, right? Posturing, that is hand above the head. Echolalia, echopraxia, grimacing, ambitendency, stereotypy, mannerism. Okay. Then we have antipsychotic as a treatment, mainstay of treatment. Typical, atypical, chlorpromazine, haloperidol, clonazepine. We will learn this in our pharmaca section very detailedly. Very important drug. D2 antagonism, D2 and 5-HT2A. It shows it acts on positive symptoms, it acts on negative symptoms. Then here extrapyramidal symptoms are high, less. Metabolic side effects are less, high. So the side effects, extrapyramidal symptoms, movement disorder. Here we have drug-induced Parkinsonism, we have triad tremors, rigidity, bradykinesia. For treatment, we use anticholinergics, penstropine or trihexyphenidyl. Okay, clear. Then we have acute dystonia, sudden contraction of muscles, torticollis, trismus, deviation of eyeball, laryngospasm. Treatment will be IM anticholinergics, promethazine. Then we have acute akathisia, propanol will be treatment. Tardive dyskinesia, long-term usage of drugs, it happens. We will treat symptomatically. Neuroleptic malignant syndrome. This is a neuroleptic type. Okay, neuroleptic. Don't forget. Okay, neuroleptic malignant syndrome, D2 blockage. Due to D2 blockage, symptoms will be seen. What are the symptoms? Muscle rigidity, heat regulation will be disrupted. Muscle injury, which leads to CPK in the blood serum, which is called as myoglobinuria, leads to renal failure due to causing AKI. So we have good and bad prognostic factors. Good, bad, acute, insidious onset. More than 35 is a good, less than 20 is a bad. Females good, male bad. Positive symptoms good, negative symptoms bad. Family history positive good, then negative bad. Oh, this was a very concise note for schizophrenia. I hope you enjoyed it. You'll watch my other videos also. Kindly like and subscribe so that we get motivation for our further videos. Okay, subscribe. Have a great day. Thank you.